foramen here all the way down the spinal cord. So the thing to notice is the spinal cord starts up here at the brainstem, goes down, and it stops right here. This is about L1. This is like at the very beginning of the lumbar vertebrae, right under the ribs. And it stops. And everything down past that is just spinal nerve. This area where the spinal cord proper stops is called the conus medullaris. And everything past that, these spinal nerves that extend past that, is called the cauda equina, and that's a horse's tail. And so you've got the conus medullaris, the cauda equina, all these nerves that go past that. The nerves that come out of the spinal cord, or come into the spinal cord, both, they're bundled together in nerves out here. They form a network that we call a plexus. And we have different ones for different parts of the body. Up here in the neck, there's a cervical plexus. Here in the arm, there's a really big brachial plexus. In between the ribs, we don't have a network anymore. We just have individual nerves coming out in between the ribs. Every nerve in between the ribs is called an intercostal nerve. Intercostal means in between the ribs. Down here in the lumbar vertebrae, the nerves come together into a lumbar plexus. And then down here in the sacrum, it comes together into a sacral plexus. Another structure that you should be able to find on this model is this pink thing that's up here and runs right beside the spinal cord all the way down. This pink thing is called the sympathetic trunk. And this is where the sympathetic nervous system's ganglia are all the way down beside the spinal cord. If you have your list from Blackboard, it has the numbers on it, because this model is keyed out nicely. And you can find the numbers and identify the structures based on that. So those are really pretty easy to find. Another model where we don't have a lot of structure to discuss, and it's keyed out nicely, is this cross-section of a giant cervical vertebrae. It's a cervical vertebrae, so we're looking at it. This is the spinous process up here. Here's the body. So that makes this side dorsal and this side ventral. Coming off the dorsal side of the spinal cord proper here, you have these yellow wire things there. Those are neurons on the dorsal side. They come together with what we call the dorsal root. The dorsal root is where the neurons leave the spinal cord here, these yellow wires.
That's the dorsal root?
Yes. On the ventral side, then you have a ventral root, the yellow wires on the ventral side closest to the body. The dorsal root runs out here, and then you have this really wide sort of fat bulge in the nerve right there. It's called the dorsal root ganglion. And then the dorsal and ventral roots come together into this big nerve that's a spinal nerve. And again, these structures are keyed out on your list from Blackboard. Other structures that you need to know. Okay, so in the spinal cord, white matter is white and gray matter is brown, just like the brain. In the center of the gray matter of the spinal cord, right in the center of the spinal cord, there's a hole. That's called the central canal. Cerebral spinal fluid flows down that central canal. Here on the dorsal side, there's a big white column. That's called the dorsal white column. The other two terms that you need to know for the cervical spine there are spaces. One of them's on your list and one of them you need to add. The one that's on your list is called the epidural space. Epidural means above the dura mater, and this is a cavity that's normally consumed by fat. So this is this fat tissue that's out here above the dura. And you can see it's fat, it's got big blood vessels in it. Fat out there, fat here. The other thing, and the one that you need to add to your list, is the subarachnoid space. Subarachnoid is under the arachnoid membrane, and it's the empty space that's directly around the spinal cord itself. That's going to be filled with cerebral spinal fluid. So this empty space out here would be fluid filled, and that's the subarachnoid space.
And you said it's above the arachnoid?
Under the arachnoid.
Okay. Does it have a number on it?
No, it's just space.
Oh.
So when you do something like a spinal tap, or a lumbar puncture, you're putting the needle in the subarachnoid space to pull out cerebral spinal fluid. When you do a lumbar puncture, it's called a lumbar puncture for a reason, because you do this in the lumbar vertebrae, in between the spinous processes. And ideally, you're going to go as low as you possibly can. The reason for that is you don't want to hit the spinal cord. Down here, all that is, those are just nerves. The cauda equina, just nerves. You can't do any damage there. Up here, you paralyze them. So you use our anatomical landmarks from the bones, either the iliac crest or the posterior superior iliac spine to find the junction between L4 and L5, or the junction between L5 and S1, and you put the needle, it's a really big freaking needle, in between the spinous processes of the vertebrae, through the dura mater and into the subarachnoid space, and you withdraw a little cerebral spinal fluid, which is kind of clear. When I watched this, like the first question I had is, how do you know when to stop? And he's like, oh, you can feel it. He's like, listen, you can hear it. And if you listen really closely, you can hear it. Or you can just see, because the dura mater is really thick, and the needle hits it and stops, and then you have to push the needle past it. Yeah, it's really disturbing. We'll watch lumbar punctures later. It's great. All right, so there's that. The last model that we need to look at today is this model, and as we're talking about the dura mater, this is a model of the dural septa, the partitions in the brain formed by the dura mater. So we have different partitions in here that keep your brain from sloshing around in your head. The first one that we'll look at is this one that keeps the brain from moving left and right. It goes in that longitudinal fissure. It's called the falx cerebri. Cerebri for cerebrum, because it goes in the cerebrum. It's got the Roman numeral 1 on it. We take this out and we look in the bottom here. There's a floor here for your cerebellum to sit in. The cerebellum sits on top of this. It's called the falx cerebelli, and it keeps the cerebellum from moving any further down. Then there's this structure on the back here that looks like a little tent. It goes on top of the cerebellum, and it's called the tentorium cerebelli, which means cerebellar tent. And they have Roman numerals on them. The falx cerebri has a Roman numeral 1, the falx cerebelli has a Roman numeral 2, and then the tentorium cerebelli has a Roman numeral 3 printed on it. So those are also really easy to find on these models. All right. Also on your list from Blackboard, there is a section that says thoracic spine model. You can mark those vertebrae, you mark those terms off, because I don't know what happened to that model. I don't know where it is. Right, thoracic spine, there should be 3 terms there. Dura mater, arachnoid, pia mater. You can mark those off because I don't know where that is. All right, so that leaves us with the nerves in the arms and the legs, and we'll look at those next week. All right, so that's it for now. We're good. If you want to look at these models that are up here, you can look at your keys, take pictures, whatever. Otherwise, we're done, and I will see you next week.